but also being your own advocate. Owning your diagnosis is what I always say, and don't let it own you. And speaking of resources, when I was writing the book, I always advocate for first, second, and even third opinions.
Hi, this is Unlimited Access. My name is Levi. Shannon.
Hi, Shannon Ellsworth.
Hi, Arlene Karole.
Hi, and as you can tell today, we have a guest on the show. So over the last year, Shannon and I have been recording this show with the idea of really connecting with people throughout the medical industry. And a lot of our content has been focusing on the caregiver, medical professionals, whether they be physicians or even people at the hospitals. But today, what we really want to do is really dive into the idea of a patient and what that experience is like. And Arlene, you not only are a patient, we want to hear your story, what you went through, but you also have a background in health. So why don't you just kind of give us a little bit of a background and introduce
Sure.
yourself?
Sure, absolutely. So I am board certified in healthcare management with the American College of Healthcare Executives, and a fellow. And I'm also a CHCP, which is a certified healthcare professional. And I've got my master's degree in health services administration. And over the last decade, I've worked as a healthcare leader and educator. And I've become, through recent experiences, an advocate and also author of Breast Cancer Just Diagnosed: What to Expect, What to Know, and What to Do Next. And I'm also founder of Illumination Associates. And that's a platform that I developed to help educate patients and caregivers on how to take charge of their health. And I also serve on numerous health-related or healthcare-related organizations, such as the American College of Healthcare Executives. I'm a member of the Clinical Leadership Committee. I'm also a member of the NCBC, which is a national consortium of breast centers. And I am a founding member of their Leadership and Advocacy Council. And in fact, in March, I'll be attending and speaking, doing two presentations in their 33rd annual conference. And one of the presentations is with Dr. Lauren Cornell from the Mayo Clinic, and it's going to be called In the Eyes of the Beholder. And it's really a session on a conversation between that patient and provider. And then also I'll be speaking on the patient-provider partnership and transformation through adversity. And I do a lot of speaking and writing on various health related topics. I'm a columnist for a National Breast Cancer magazine. And the topics that I'm most passionate about, that we'll, I'm sure, talk about today, is really, as a patient, owning your diagnosis. And then once you're past your diagnosis, it's really important then, as we go on to live well and thrive, how we become co-creators of our health and wellness. And then doing that, working together with our providers and clinicians, because ultimately those are lifelong relationships. And again, I think I have a bit of a unique experience, as over the last decade, working specifically with physicians and clinicians and health systems in that space of medical education, where my job is to help them, close the gaps between that current and best practice to ultimately achieve the best patient outcomes. And it's really having those experiences as an administrator, as an educator, and as a patient that has given me the ability to understand, both sides, and to really, share my journey and have a holistic approach in working together, with our providers to, again, create that, that optimal patient experience.
That's incredible, Arlene. Every time I hear it, I learn something new about your background. Like how do you even say all that, right? Like that's just impressive. It's a life well lived as you go. So I love it. Now, you mentioned a platform that you said for patients. What it was, Illuminate. I didn't catch. I hadn't
So
heard that.
yeah. Illumination Associates, it's actually amkjustdiagnosed.com. And when I was going through my experiences, I started to come across all of this information, and a lot of it, is in my book, which started out as 63,000 words and became a 309-page book. But a lot of that information I've also shared on my website, because it's very important that, people have access to information. I always say knowledge is power. And I think that's just really important. So I share that information, not only in my book, but on my website. as well. And yeah, I share a lot of resources and even some downloads for patients. I know I just spoke the other day at WellSpan Health. It's a very wonderful health system down there in Gettysburg, Pennsylvania. And in fact, I had given out these little bookmarks, and on the back, I, have downloads on questions that you might want to ask your provider, right? Because it's really important that when we meet with our providers, we have that 20-minute window with that. So we really need to kind of use that time wisely. So there's that download, and also just a form on, how to record information from your physician to the office manager, because, again, all of this stuff starts to build up and you have all this information, and you want to kind of keep that in one place as a patient, just to be well organized.
Perfect.
The
Believe it.
you said you had cancer, and again, we're talking to you primarily not because of your background, because but you had cancer.
Right.
Your advice you told us when we were talking about setting up the show was this idea of like, listen to your body. What does that
Right.
mean? Tell us about your cancer. What does it mean to listen to your body? And are you healthy now? Are you cured?
Yes. And yes, and yes. So, one of the first things, I call it the 7 steps, really, how to own your diagnosis, right? And this can frankly apply not only to breast cancer. I had a friend of mine from Mardi Gras, big band guy, he saw one of my posts on social media, and he's like, Arlene, I have to talk to you. And he had noted that a couple of my 7 steps were exactly what he did for his diagnosis. And he had, liver kidney cancer. So what it means to listen to your body is, initially when I had been diagnosed with breast cancer, prior to being diagnosed with breast cancer, 3 mammograms showed negative. It showed nothing. And it was really, I was getting this like little pinprick on my right breast. And I went to my gynecologist and then ultimately a breast surgeon. And it was that one day I was walking out of her door, and we did a ultrasound. It was negative. We did, 3 mammograms. It was negative. And, she said, Arlene, you're fine. There's nothing here. And I looked back at her and I said, I'm telling you, something doesn't feel right. And she's like, Arlene, it's fine. And I said, I'm walking out the door, and literally had my hand on the door. And then she said, wait. And it was in that moment um, that she said, we'll send you for an MRI if you don't need an authorization, whatever it is. Lucky, blessed, the universe at work. I didn't need an authorization, right? And so it was that within that next week or two, I got a phone call at literally, I remember on a Friday night at 5:45 coming back from my job out on Long Island. And they said, Mrs. Karole, you need a, CT chest scan or right lymph node biopsy and a couple of other tests. And I'm thinking, what is this for? And so, I went back, I got those tests. And, if it wasn't for me being persistent and really listening to my body, I think that, would I have paid, whatever it was for an MRI in the New York, area? I mean, several $1,000s having, all of these tests show negative. So really listening to your body. And it was that little pinprick that made me say something just doesn't feel right. And then just furthermore, after we took 2 breast needle biopsies to, kind of just see how much the extent of the DCIS, which was 8 to 9 centimeters, I had 2 breast needle biopsies, missed the fact that I already had invasive cancer. But not knowing that, I chose to have a mastectomy of my right breast because, you have, different options, right? And I didn't want to wait and see for anything to spread, because at the time my lymph nodes were clean and everything was pretty, okay. So, yeah. So just really listening to your body and acknowledging that.
I think that's an amazing story. And I think there's 2 things in there that I want to add and one I want to comment on, because my mother went through the same thing, and the accepting no for no, listen to your body. One of our doctors said it's an art. Medicine is an art. It is not a science. And quite frankly, if you look at our healthcare system and the disease is going out of control, not every doctor knows every manifestation of diseases. One of them said, listen, you can have twins that have the same diagnosis, present differently. So, and my mother, like, I was like, I'm not going to say, first of all, I'm in sales. So no means not now, or go ask somebody else. Right. So I asked the world, but she kept saying, I just don't feel right. I just don't feel. She would say, Shannon, and she would call me to say, I just don't feel right. And I'd come over and I'd be like, you don't look right. And then I'd go be her advocate. So I think that's a really powerful piece. Again, it reminding me of why I loved your story and like my question is going to be why a book, but I'll ask that in a second.
Okay.
But that's number one. And number two, I think your point about the insurance and the payment options. I met another woman who had a very similar story in Nashville a couple weeks ago, and she said, you can self pay. Her story is you can actually self pay, and there are self pay rates that are significantly cheaper
Yeah.
than what the insurance, but you have to ask for them. So I don't know, like, you're a healthcare person, so I don't know if we go down that path, but point being is, like, I didn't take no for an answer, and there are ways to get support. There are ways to get financial help. Listen to your body, know it, and then look for answers. Look for help. There's my mother, we filed for a lot of financial support from charities and things like that paid for her stuff that wasn't covered because she didn't have, sadly, my mom didn't work for a good chunk of her life, so she didn't have a good buildup of financial resources and things. Because again, think about her age and where women were just starting to build wealth. She didn't have it.
Mm.
So we were able to get those resources. So I think, I don't know if that's part of your book, and not to
Yeah.
turn it to my personal
Yeah.
agenda, but
No, that's
just you said is like that, those decisions you have to make, like, can
yeah.
I afford an MRI and is it
Yeah.
covered? That should
Yes.
not be a question. There should be
Yeah.
resources and things that people come and say, listen, if you can't afford it, we'll help you.
No,
Don't
that's
not get that.
yeah, absolutely right. And I think you said numerous, incredibly key things, but also being your own advocate. Again, just owning your diagnosis is what I always say, and don't let it own you. And speaking of resources, when I was writing the book, when I was in the midst of writing the book, I always advocate for first, second, and even third opinions. I mean, I cannot tell you how many physicians that I went to, right? I think that's really important. But when I was going through this, I started to think, wait a second, I've always been blessed, lucky, whatever you want to call it, to have excellent health insurance, to work with really amazing organizations that provided health insurance and co-pays and all the things I think we take for granted as patients and as people, those of us who have always had that, resource and access. And so when I was writing the book, in fact, one of the appendices at the end, I then felt a little bit guilty because I'm thinking, what happens if somebody doesn't have a $20 copay, or someone doesn't have money for an MRI? At the time when I was writing it, I actually came across, at the time, Christina Applegate had a website because her diagnosis was also missed. And it was the MRI that caught her diagnosis as well. And then also, so it's very important, to have resources. And, speaking of funding, early on writing my book, when I was researching, wigs and wishes, cancer and careers, I came across the Pink Fund by Molly McDonald. She's a CEO. She runs an incredible organization. And again, I have that in my book. I have it listed on my website. And she basically, helps support women and funds them, for, things like, co-pays or medical tests within those first 90 days. She does really a great job doing that. Also, I think it's Angel Transportation. There's numerous, organizations that if you can't commute or you can't get to your, medical, appointments, then, they'll help support that too. So I think, having the resources is great, but if you don't, there's, like you said, Shannon, there's so many resources out there. Yeah.
That's
That's awesome.
health things to me are always just really scary, right? It just seems
Yeah.
like, even even though it seems to me like you're obviously very healthy now,
Mhm.
you must have been really scared when that took place,
Mhm.
right? Is that me? Especially
Yeah.
because you
I
have a
mean,
background in health, right?
yeah, well, it was terrifying, and I had never been ill really in my life. I had a laparoscopic removal of my appendix like 20 years earlier, and otherwise our family lives well into our 80s and 90s, so it was really terrifying. And one of the things, I'm actually writing an article for an organization that's due on Monday. But one of the article actually is about exactly kind of what you just mentioned, in that I had to remove the fear. And how I did this, how I got through this, frankly, is I had to manage my diagnosis like I did my job, right? And that's how the book, in fact, really came about. It was about organizing information and organizing resources and organizing chapters. And that kind of, for me, helped remove the emotion out of it. But certainly, you go through a series of emotion, from absolute being terrified. You have breast cancer. We don't have breast cancer in the family. I have no BRCA gene. We don't, again, we live well into our 80s and 90s. But then then it goes to denial. I wanted to see the actual pathology charts myself. I wanted to see the slides myself. I sent them to numerous pathologists because maybe I have the wrong slides. So you go through this, crazy roller coaster of emotions. I'll tell you one quick story. I had gone for a second, or at that point, it was probably a third opinion. And I was going to this hospital in New York that I've always went to for all my appointments. And this one appointment, they said, you have to go to our Midtown location. And I said, okay. I mean, didn't know of any facilities they had there, but, I did what they told me to do. And so as I'm walking and getting closer, it was in Madison, Midtown, and Manhattan, I started to see the facade, their logo on the building. And I was getting closer and closer. I'm like, okay, great, I'm here. And the words that jumped out to me was cancer center.
Mhm.
And it was at that moment that I literally, Levi, felt so sick to my stomach and terrified, because the first thing that, before I even registered that it said cancer center, is I thought, I don't have cancer, do I? And I mean, you just can't believe it, right? They always say when it happens to you, but it truly is that kind of, gut wrenching feeling. But, then it's what you do with that information, right? It's
Right.
how you kind of then empower yourself. I just want to read a quick quote that I started my book out with. And I have in the beginning chapters and at the end quotes to inspire people. But I always say, look for your inspiration, right? But this is the first quote I have in the opening of chapter 1. I say, everything can be taken from a man, but one thing, the last of human freedoms, to choose one's own attitude in any given set of circumstances, to choose one's own way. And that's by Viktor Frankl, who is a Holocaust survivor. And I thought what I loved about his quote, and, if there's any words that run through and thread through my story or my book or my website or what I try to deliver to other people, is we have choices, right? And we do have some semblance of control over our diagnosis. And while we listen to your body, the other items are also go to the doctor. Make sure you take notes. In fact, that's how my book came together. And then on the bottom of each page, I have little lines for people, not a workbook, but to kind of, take this information down. Bring someone to help you, reach out for help, and get copies of your medical records. I know, Shannon, we've talked about that a lot, and do your research. I always say research, research, research. Always make sure it's evidence-based, based on science. But, these also help us to get a sense of more control, right? When we know our diagnosis, we're not just, going to the doctors, and, we're active in our diagnosis, and, kind of can take ownership and control.
So did you like Levi? Now you know why she resonated, right? What did we say was one of the main things that we wanted to do with Ursamin? This is not to plug Ursamin. What is it?
Well,
Choice.
yeah, choice. Yeah, and it's
Choice.
funny.
It was choice. It was choice. Sorry, go ahead.
No, I was gonna say
Yes.
Viktor Frankl, A Man's Search for Meaning, is just a great, powerful book, and it's fitting that you use that as a reference too, because for a quote, because you're right, Shannon. Choice. The one of the things that's probably really scary for all of us as we go through these medical things is we feel like choice has been taken away from us.
Yeah.
And
Yep.
that's exactly so Arlene early, like, I don't know, if you look at some of the episodes, you see us fumbling around with like, what's our mission? What's our culture? What do we want? What do we truly, from a gut perspective, feel? And I said, choice was what choice. I watched my mother. I've not been in this as a caregiver, and watching my mother and my friends. And I actually just coached a friend through it yesterday because her mom is handling her brother's care. And there's all these pressures. And I said, listen, Lori, the best you can do is give them choice, relieve the pressures, and present the choices
Yeah.
and how you can move forward. And
Yeah.
that's what I resonated. I know we talked about so many different things. There's again, your background's so um well-rounded that there's
Mhm.
so many topics we could have. But the piece that got to me was
Mhm.
you want a choice. And once you have choice in a scenario where that is, I remember my mother, she's like, I feel so alone. I
Mhm.
feel so alone. And I was there every day and I couldn't, no matter how close I was to her, I couldn't, her husband couldn't fix that aloneness. But once she had choices and I figured out, hey, here's choices, mom, I'm not pushing you in any direction. You do
Mhm.
what you want. And as a child, yes, I'm going to fight to push in a certain direction, right? And she's like, "Listen," and I realized that that choice was, like, really a critical piece, and that's what we try to remember in the foundation of Ursamin is how do we continue to provide choices to people depending on the path, and it's like a book that we grew up with where you're like, "Hey, do you wanna go down this path? Go to page 7." We want people to have that choice without it being so overwhelming, which right now, again, at the time, I think my mom and maybe you, there's almost too many choices sometimes where you're like, "I
Right.
you also need a guiding hand from
Well,
your
yeah.
community to say, here are some of your choices," and that's why we're looking
Yeah.
at what can the medical community do with us.
Absolutely. And the two things on that, or a couple of things, I don't want to digress too much, but, certainly bringing someone with you and that sense of being alone. I mean, my first, as I call it, breast friend was basically Tom Hanks' wife, Rita Wilson, who was just diagnosed around that April when I was as well. I knew no one with breast cancer and I was embarrassed and I was frightened
Yeah.
and I didn't want to share. But I have to unfortunately say, once I started to open up and talk to people, because you need that support, you need to bring other people in. You can pretend so long that everything is fine. And then, you're going to work and you're going through the day and it's really gets difficult. Once you open up to someone, the floodgates usually literally opened. And then I started to meet and speak with women who weren't even far removed. It wasn't like a friend of a friend of a friend who had breast cancer. It was a mom, it was a sister, it was an aunt. I mean, and then I started to realize how prevalent actually breast cancer still is, as many events and fundraisers and research, I thought, oh, breast cancer is fine.
It feels like yeah.
Yeah, but the fact is, it is prevalent and so bring someone with you because actually one of my best friends and Anita came with me and she actually, and I always tell this to others, whoever it is, a friend, a colleague, whatever, a caregiver, a healthcare worker, whoever it is, you can bring, they Anita asked questions that I was frankly too exhausted to ask, and I'm pretty assertive and go getter, but I was exhausted. So she would actually ask questions that I had forgotten to ask or such, and she also asked questions that I was afraid to ask. Right, and then so definitely to your point, Shannon, bring someone with you. And as far as choices, you know, there were a lot of choices, and frankly, not one physician told me what to do, not one. And so, what I did when I talk about research, I have numerous organizations that I share with people to go to. It's called breastcancer.org and also the NCCN guidelines. It's a National Comprehensive Cancer Network. It's actually, for all, cancers and oncology. And it gives you different options for every single cancer. So, for my cancer, at the time, it was either, get a mastectomy of your right breast, get a lumpectomy, or get, radiation and such. Or, it was three choices. And it was really then doing that research, then going to my doctor and have a conversation. But I made that choice on my own. Not one physician would tell me really the way to go. And in fact, for my particular diagnosis initially of DCIS, 50% of the medical community do not believe it's cancer and want to remove the C from ductal carcinoma in situ. And then the other part of the community, they're like, no, it's cancer and you need to manage it as such. So I literally ended up, I think it was my chapter 8. I wrote a chapter on DCIS specifically because there's so much controversial information about that, at least from my experience. And so I just really wanted to, share that with others because I had found many others were confused about, what to do as well. But researching, knowing your choices, of course, talking number one to your medical professionals, is key. But yeah, yeah.
Wow. Well, thank you so much for sharing your story, and it's good to know that you are healthy again, and you're vibrant. Actually, you've been in this world of health for a long time, at least according to your bio as you're kind of going through all this. What even got you into this,
Mhm.
industry?
Yeah, I had started out early in my career. We're not going to go back that far, but really in nonprofits, and working for national organizations, in health, like the American Lung Association, and even very early on, the Archdiocese of New York and Catholic Youth Organization. And I was always involved in, helping others, whether it be children in need or, hosting fundraisers that, we raised money for the mission of the organization, but always kind of giving back in one way or another. And I think that, to be in healthcare, again, I always consider myself a servant leader, right? And, that's a word just I love and its meaning, and just really helping to positively mentor and influence others. And, coming up over the years of our careers, we learn so much, and just kind of really, I always love this term too, paying it forward, right? Just sharing our experiences with others to help them to make their journeys easier. So, yeah. And I think education is really at the root of everything. Certainly what you all are doing with your company and organization and mission. It's so important. It's about education and, connecting and bringing people together, and, and doing all of that. I have to say too, there's one funny quote I take from The Wizard of Oz, right? That last scene when Dorothy is, finally going home, and she clicks her, shoes and all of that. And Glenn, she says, how am I going to get home now? The hot air balloon just left. And I have in the epilogue of my book, Glinda the Good Witch says to her, my dear, you've always had the power to get back home, but you had to learn it for yourself, right?
Mm,
So we
Love
as
that.
patients, we have the power, right? We just have to use it. We have to tap into it, and we have to access it. And I think that's what you guys are doing so nicely, with your services and product, frankly. You're kind of giving choice, you're giving access, and bringing everyone up and along with you. But certainly as patients, I think, we all have the power. We just have to use it and tap into it. I think that's important.
Yeah, I think what I want to do as a follow up is I may ask you a few questions because I have a question, but this is a loaded one, and it's what can we do as a platform for patients? And I think it's a loaded one. Like there's probably a lot of answers. There's a lot of things like even everything you said, I'm already writing things down that I know we can do, but where can we in at this stage and listen, your stage, like to us, people go, we talk about records. Listen, that's a problem, but we're like, where can we bring the most value? I have friends who are like, hey, I had one who said my uncle's stage 4. I'm like, we can help with advanced directives, things like that. We are not at that point. You're in an acute stage where you've got people that are just carrying you through that. That's not our game. But a patient who's at your stage, like, what do we do then? And how do we make sure like, I'm actually was writing down, what do we like, one of the things a caregiver can do to help you, I think, is find local support groups, right? How do I get you a local support group? Because quite frankly, again, I can't relate to what you're dealing with. I haven't had breast cancer. I'm sure you hear the platitudes of, "Oh, I know how you feel." And you're like,
Mhm,
"No, you don't." That's the
mhm,
most diminishing term somebody
mhm,
can use is I know how you feel. No, you don't, because that's removing my ability to feel. Again, removing my choice when I already don't have a
mhm.
choice on a disease that I have. But I really want to follow up, and that's why I said it's kind of a loaded question. Like, what are the things and think about at that stage when you were diagnosed? What are the top things that you really could have used from a platform so that again, I think the problem we also have is everybody talks about the patient
Right.
without the patient in the room. Like,
It's
how about the patient gets the
right,
voice? And that's where I said we're missing
right,
that piece. We're kind of going down this path what everybody else is, even though we're fighting for the patient. We're like, hey, how about we bring the patient into the conversation? I think the whole industry is struggling with how do you really put the
right.
patient in the center?
Well,
We're just
yeah,
like,
yeah. Well, look, really honestly, in this book, I mean, That's exactly
That's
what
it?
I needed. This is
Okay.
what I needed, and this is why I
Perfect.
wrote it. I mean,
Perfect.
this was a tremendous lift, but at the end of the day,
Perfect.
when I went to Barnes& and Noble when I was first diagnosed on
What'd you find?
81st and Broadway and sat there and ripped every single breast cancer book out of the bookstore pre-COVID, obviously, I found 2 types of books. One was maybe people like myself, but the books were really dated and not necessarily relevant. And
Yes.
or they were written by celebrities, not to name names, but there was one populous celebrity. And, I'm like, well, I can't really relate to her. And not that she didn't have valuable information, but, I mean, I'm sure she didn't have to worry about,
Crowds of one and even
insurance or right.
yeah.
And then the last kind of book was actually 3 now, were by medical doctors. And I needed a book to read the book. So in my book, I didn't want to certainly recreate a dictionary of terms. However, I did create a glossary because at the time, I didn't know, frankly, exactly that while I was researching breast surgeons and oncologists and plastic surgeons, who is the most important person I came to find in that surgical suite with me? Well, it's the anesthesiologist. So I made sure to meet with the anesthesiologist. Not an easy feat. I didn't know, frankly, what mastectomy exactly meant or metastasize. I mean, so I literally did an A to Z, of what to most people who are clinicians would be ridiculously simple, but they're used to that speak all the time. We're not as first time cancer patients. And although I did work in a health system, and have been in medical education for over a decade, women's health, prevention, cardiology, oncology, radiation, otolaryngology, and the list goes on, managing all of these educational conferences for our physicians. I had never been a patient in that system. I had never had cancer. So, you're literally starting from scratch, regardless of all the maybe little edges that I had here or there. And, really, it was my type A pushing New Yorker that, and fear to Levi's initial, question that really propelled me forward to get in those doors. And to be frank, I had numerous second opinions that I stopped saying it was a second opinion because I actually told physicians told me, well, if you're a second opinion, I'm not going to see you, you know, anyway, but we do
So
have
the
choice.
answer is read the book. So the answer
Well,
is
yeah,
get
no, yeah, there's
read
a,
the book.
yeah,
I'm putting it all over in our resource page. We actually might write a blog on it now because I had been reading it. Of course I got like 7 books I'm reading. And I love that because you're like, it's there. And so I really want to dissect that a little bit more.
so anyway, thanks for listening.
No,
Listen.
it's so important, and
Yeah,
one of the things that we like to do is not only just give you a chance to speak a little bit about your story. We'll definitely have some links in the show notes and everything
yeah,
for
that
people
would
to
be good.
access everything, and that's
Perfect.
great.
Yeah.
Well, Arlene Carole, it was lovely having you on the show, and thank you
Yeah.
so much, and hopefully we get to have you again.
Thank you guys so much. It was
Yeah,
great.
thank you. Yeah, thank you, Arlene. This was amazing. Thank you. It was awesome. I could see like 4 episodes on this conversation.
Yes.
Listen, we'll start and
Thank you.
we'll follow up. Thank you.
Thanks,
Yeah.
guys.